Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to talk about some sunscreens, right? So we have had one patient who had come to us and for an anomaly, right? And then she was a frequent flyer, right? Okay, she had a lot of she was a working professional and she had a lot of outdoor activities. And she was talking about sunscreens. I was talking about the cosmic radiations and the exposure of the radiations that probably and the natural environment and the terrestrial radiations that happen and what is the background risk about those radiations and what is the sort of an threshold for that sort of a radiation exposure during the entire course of the pregnancy of 9 months. And we were not getting into the right perspective. She was talking about the sunscreens, I was talking about the radiations. So this has led to this sort of a video. So probably let me go through those slides and then probably we'll talk about and then we'll try to put all those things in the right perspective. So look closely. During the entire 9 months of pregnancy, we are being exposed to a low level radiation, right? So this could be a part of a cosmic radiation or a terrestrial radiation, right? Everybody knows the CT and X-ray, but probably we are going to highlight on an air travel, especially the long flights, right? So the cosmic radiation could be there, and X-ray, CT, everybody knows, right? 5 millisievert is the threshold, right? So look around in the last line, 100 flights long haul, which is pretty huge for a 9 months duration. And the air travel specifically in the first summer should be avoided. Now, as far as sunscreens are concerned, we do have a UVA and UVB, right? So then we have an SPF. So SPF 350, 30 to 50, it is an Avino, and more than 30, it could be banana boat and something else, right? And the oxybenzone derivatives and vitamin A derivatives sunscreen should be avoided, right? We should even avoid an spraying spray because then they can get inhaled and all those stuff, right? And these sunscreens don't save us from those radiations, okay? X-ray radiation. So what we identified is that the sunscreens, they can save us from a UVA and UVB exposure, right? And then probably we need to identify between the ingredients, right? So there are few ingredients that should be avoided, right? Vitamin A derivative ingredient sunscreen should be avoided. SPF 50 is usually the best one, and then spray should be avoided. But only thing is this, that they can cut down onto the UV radiations, not the X-ray radiations, right? So, and these cosmic radiations or a terrestrial radiations on a long flight, haul flights, they can really lead to those exposures of those cosmic radiations. These are all cumulative, meaning thereby that probably we've identified it is 0.03 to 0.05 millisieverts, and our cutoff is 5 millisieverts. For all practical purposes, we would need 100 flights, long haul flights, so as to accumulate those 5 millisieverts sort of a radiation exposure, right? But these radiation exposures are cumulative, meaning thereby that it is not something that probably I'm going to accumulate all these things in the 9 months itself. And but then whatever I've been doing, so meaning thereby that for all practical purposes, this long haul flights during the first trimester should be avoided. And sunscreens, they don't protect us from those cosmic and terrestrial radiations, right? So they only protect us from UVA and UVB sort of radiations, that is exclusively for the freckling, skin pigmentation, probably some skin cancers and all those stuff, but not the radiations or ionizing radiations, cosmic or terrestrial radiations, as a matter of fact, right? Thank you very much for your patient listening.